Hi, I'm Dr. Debmita Dutta and this is whatparentsask.com. So, dengue is a frightening disease and everybody is afraid of dengue. But it's not enough to be afraid of dengue. Here's what you should know about dengue. So, dengue is caused by a virus, and so initially the disease looks like any other viral fever. So, there's fever, headache, body ache, etc., etc., and there's no way to say that it's dengue. It is important, therefore, to pay attention to each and every fever and not neglect it as a viral fever. Always take your child to the doctor on the first day of any fever. It helps when the doctor has seen the child on the very first day of fever, because when you go back to the doctor afterwards, the doctor knows whether the child is improving or getting worse. In dengue, the danger signs are rash and bleeding from anywhere, the nose, the gums, etc. These signs tell you that you must rush your child to the hospital immediately. The worst thing about dengue is exertion. It can make things very, very bad for the child. It is very important, therefore, to allow your child to rest if he has fever. Do not send him to school. If he has dengue, this could be very, very bad for him and make things much worse than they needed to be. Also remember not to relax when the fever goes down. Do not push your child back into all his activities as soon as his fever comes down. The complications of dengue begin only after the fever has gone away. So, even after your child has recovered from fever and has no fever, rush your child to the hospital if 1. Your child looks lethargic and tired. 2. Your child complains of stomachache or vomiting. 3. Your child has red rash or spots on the body. 4. There's bleeding from anywhere, the gums, nose, etc. 5. If your child is passing stools that are blackish. 6. If your child has cold, clammy skin. And 7. If your child has difficulty in breathing. Remember, these are dangerous signs and mean that your child is going into complications. You must rush with your child to the hospital if you see any of these, even if there is no fever. Dengue is a complicated disease and there is no cure for dengue. So always be extra careful about not allowing mosquitoes to bite your child. I'm Dr. Debmita Datta and this is whatparentsask.com. Thank you.